everyone, welcome back to another episode of MIXTAPE Podcast. We are coming back after a bit of a gap, but live. So today I have a very special guest with me. I have Jahan Ara Chughtai with me. She is a trauma-informed therapist who has trained from University of Rochester, New York, and in Lahore she has a private practice. And the reason I invited her was because I felt that this conversation is going to be a bit timely one. We all have recently seen news, and somehow either as a donor or if some of us were, more passionate about it, we were on the ground doing some relief work for the flood relief victims. But it has a consequence on the mental health of those who are working or engaging in the relief work. And today, this is what we're going to talk about. So welcome to the show, Jahan. Thank you for the time.
Thank you so much for having me. Yeah, thank you so much for having me. I'm very happy to be here.
So let's start before we dig into the big question that we want to talk about today. Just give a brief about how you decided that this is what you wanted to do specifically, because in Pakistan, this is still I would call it a budding profession, because still mental health is now being explored at a very, primary level compared to how it's being talked about in the rest of the world.
Absolutely. And, Fatma, I think in Pakistan, it's a very underdeveloped profession. And in the world, it's a budding profession because I think psychology and, there's sort of regulation and licensing and modalities, they just started coming about maybe 20, 30 years ago. So in essence, even the whole profession is very new in nature. But I think like a lot of other therapists, I decided to go into it. They say that a lot of therapists are the conflict managers in their families and are the acha bacha, the one who's a good listener with friends, the child who wants to be seen. So I think I relate to all of those. And I did my undergrad in applied psychology as well. And there were different courses on counseling. And I realized, wait a second, I'm good at this. I can keep going. And then I decided to pursue graduate school in counseling as well. I trained before that for a year. But yeah, it's something that I'm passionate about. And it's also something that kind of relates to your topic because in some way it is relief work. We are sitting with people who have very traumatized nervous systems, and we're doing that daily, hour after hour. So it's a very important thing to really talk about. So great topic, and happy to kind of explore it further.
So as I mentioned in your introduction, you are a trauma-informed therapist. What is trauma what is the technical definition of trauma?
So a couple of years ago, and by that I mean some decades, trauma was seen as something that you talk about to get over, or you talk about to get a better understanding of. And then there were studies done, especially by Dr. Basil van der Kolk, where they studied the whole body of someone who was narrating something traumatic. And they saw that literally at a neurobiological level, people were going through that again. It was like it was happening again. So trauma is essentially something that has a lasting impact. We often see that this is something that's also, I want to mention, it's a natural reaction to the environment. It's a biological, natural reaction that your body brings in to something that's traumatic, that's threatening your survival. And oftentimes, Fatma, when people say threatening survival, they always think, maybe aapki jaan khatre mein hai, yeah, you're going to die. That's not always how our survival is threatened. Our survival is also threatened emotionally. So an emotional threat, a financial threat of survival, the threat of, our identity being lost. These are big threats for our psyche to carry. And trauma usually changes our worldview. So when we're working with people, we want to see what is it that's getting changed or that's different after the impact. And people will have different identity politics. People will have different relationships. People will have a different worldview, value system, prioritization. So these are some of the things that we see have, moved around in trauma. When someone has gone through something traumatic, something to understand is that they have lost their sense of control or autonomy in their life. because trauma is not something that knocks your window and comes in. It's something that comes all of a sudden. It's often something that's unexpected at the wrong time, at the wrong place. So when you're working with someone who's traumatized or someone who's gone through, whether that's sexual assault, floods, any kind of trauma, or just an accident as well, this is someone who's lost autonomy over their body. This is someone who now cannot control their reactions. There's a lot of shame and powerlessness that comes with that. So I think mixing all of these things together is what we see usually as trauma. It's very biological in nature. It's not just emotional. People have, physical flashbacks, right? So they're dreaming about it. They're seeing the event again and again. They're physically experiencing it again. So I'm moving, I'm shaking. I know bahir patakha baja hai, but I grown up in a place jahan bombs phatte the. So jab bhi wo patakha bajta mere haath kampte hain. Mujhe patta logically nahi hai. But it's not about logic at that moment. It's about my body saying, protect karo apne aap ko, dobara wo cheez hone lagi. So it goes into that response. So it's very physical, it's very emotional in nature. Emotional flashbacks is something that we don't talk about a lot. Emotional flashbacks is, when a certain situation is created where we are feeling the emotions that we did at the time of the trauma, they can come back very vigorously like a flood and very they can make us very dysfunctional. So all of these things are part of trauma-informed therapy, trauma-informed care. One thing to remember is a lot of people who are traumatized will not recognize it either. They will not know what's happening. People also forget their trauma, and that's also very common, and that's okay. Because I think especially with sexual assault, Fatma, when survivors come forward, people say, isko to pura yaad hi nahi hai, ye kya, ye to kya gawahi denge, kya batayenge? Because हमारे पास knowledge नहीं है to understand that that's a very common experience. The brain dissociates from memories and experiences, and that's just something that happens with trauma.
Yeah, and in addition to what, obviously, the examples you have given there are, we need to, again, we will go and further explore them, hopefully in another episode as well. But one example you mentioned was of the flood relief work. So yes, while people who suffer these quote unquote natural or I would specifically say climate change induced disasters, obviously they go through, the loss of just basic trauma, losing their livelihoods, losing their house, losing their loved ones. And even we have seen, losing their livestock, which again connects that to their livelihood. I've heard stories, obviously, where ये जो हमारा rural areas में जब आते हैं, if they have to, have a यहाँ पे बैठ के we can judge. But say if they have a child, have to choose between a child and a livestock, they will go after the livestock because that's where the rest of the people depend on. So yes, they have a trauma which we are nowhere near even exploring. We are not even scratching the tip of the iceberg. हम तो अच्छा पहले भी आए थे back to back, अब भी आ गए हैं, तो let's go give them aid, ये करें वो करें. The trauma of the people that I want to explore today is that of the relief worker. And also, because as I said, Pakistan may, unfortunately, because of multiple reasons, we get to see these things happening and unka scale bharta ja raha hai because of, lack of management, mitigation, whatever. So the people who want to help, people who still at some point are still, protected because of their privilege, they want to, come forward and donate. You always hear, आपको ये हर जब भी कोई इस तरह की mass donation drive आएगी, you get to hear these voices कि यार फिर से हो गया, फिर हम donate करेंगे, फिर कुछ सालों बाद फिर हो जाएगा. So I feel that both of these aspects, obviously people who go to the ground and see that devastation, उनके लिए भी एक traumatic experience होता है, एक separate level का, and then this quote unquote जिसको हम resilience कहते हैं, I feel that is we cover the numbness that we are collectively heading towards, which will, I feel, will end up into another disaster where we stop feeling things or reacting to things when needed. So how do you, as an expert of this field, see this, and how you think this can be managed, or these people can help? Because you said कुछ लोगों को खुद भी feel नहीं होता है, dormant हो जाता है trauma. So if you talk to relief workers, they are going then there with on ground with a very noble cause. अपना time निकाल के अपना वो अपने obviously people have day jobs, उनको side पे करके manage करके किसी तरह भी, and they are saying कि हम तो कोई अच्छा काम करने जा रहे हैं ना, तो थोड़ा सा वो religious एक aspect भी आ जाता है. But at the end of the day, it's trauma. So how do you see managing that?
Yeah, so there's many things that come to my mind. Sabse pehle, I think I want to mention that for people who are going in for relief work, it's very important to have psychoeducation with them both when they go and after they come back. Right? So काफी हमारे social workers हैं, relief workers हैं, जिसको अंदाजा ही नहीं है कि क्या हो रहा है. So we want to be able to help them connect कि जब इतनी ज़्यादा तकलीफ से आप face to face करते हैं, what are some things you could impact, जो कि emotional level पे grief आ रही है, guilt आ रही है, and there's lots of details I could even later share if you want to share on your page. Yeah. फटीग आ रही है, अच्छा रात को नींद नहीं आती, नाइटमेयर्स आ रहे हैं, जल्दी कांप जाते हैं, पसीना आने शुरू हो जाता है, हाथ कांपते हैं, टांगे कांपती हैं, they're more sensitive to different sounds, and all of these things are happening. It's very essential that when we are sending relief workers to different areas to support people who are victims of a crisis similar to floods, that we are properly psychoeducating them on what to expect for themselves. A very tricky thing that is happening is that when we are talking about secondary trauma, relief workers go through something called secondary trauma. That means you are not the major stakeholder of the loss, but you are someone who is directly connected to what is happening. Secondary trauma has all sorts of symptoms that are very similar to primary trauma that we see. I think it's about 30% of relief workers, they have higher rates of PTSD, depression, anxiety, things like that showing up. And they're like, aapko directly, you didn't experience it. But, I would really encourage people to have this trauma-informed understanding that agar aapke saath nahi bhi hua, this is something that also happens in trauma, Fatma. There's a lot of, I think a colleague of mine used the word the other day, trauma Olympics khelne shuru ho jate hain. So we get into this comparison of kiski zyada trauma hai, kiska kam trauma hai. Mera to hobby nahi hai. It's a game we get into, na? Like which iska ye kam hai, iska ye zyada hai, and nobody does it more than us to ourselves because it doesn't make sense to us. मैंने तो जाके relief दी लोगों को, I provided I guess चावल और रोटी or other things. मुझे क्यों हो रहा है, घर तो उनका खराब हुआ ना. There's a big guilt around having symptoms because people would say, doesn't make sense, मेरे साथ तो कुछ भी नहीं हुआ. But I would encourage people जो ये देख भी रहे हैं to really look at polyvagal theory. आप Google करें resources on nervous system and understand that एक चीज होती है जिससे हम कहते हैं ये दो waves हैं, ये दो लोग हैं और दो इंसान मिल रहे हैं, right? There's two energy waves. There's two different energy waves, and when two people meet, that energy waves becomes one energy wave. You are connecting with someone's nervous system and their energy, which we see in our sort of therapeutic work as well. You are feeling what the client is feeling. Sometimes जो लोगों को जैसे ट्रॉमा की बात करते हुए चक्कर आता है या डिसोसिएशन होती है, हमें एज थेरेपिस्ट कई दफा साथ उनके चक्कर आ रहा होता है. इसको हम कहते हैं इंडक्शन. दैट मीन्स कि मुझे फील हो रहा है बिकॉज वी आर इमोशनली कनेक्टेड राइट नाउ. आई एम एक्चुअली फीलिंग कि आपको भी चक्कर आ रहा है. समटाइम्स चेक इन विद क्लाइंट्स एंड लाइक आपको किससे पता था मुझे चक्कर आ रहा है. सो आई कुड फील इट. Two nervous systems, when they're aligning together, they are on a lot of similar waves and energies. और जो लोग relief work करना चाह रहे हैं, they should be really mindful of that. So पहली बात होगी psychoeducation, understanding that, understanding आपकी guilt because वो आएगी on this is not making sense. I think a really big thing, Fatma, that's a protective mechanism for release workers is preparation, finding some kind of schedule. Unpredictability is a very harmful thing for the psyche. So having a lot of knowledge and predictability in their routines, having preparation on what are we going to expect, what are some of the areas we are covering, क्या-क्या चीजें हम देख सकते हैं. जब ये चीजें होती है ना, they act as a buffer or a boost to protect mental health. Because earlier I mentioned trauma is something that is unpredictable, that comes out of nowhere, it doesn't knock your window, it doesn't knock your door. So when we want to create a certain sense of predictability in their routines, a certain sense of schedule, that creates as a big good buffer. Other than that, अगर कोई organizations ये podcast सुन रही हैं, तो I also have a suggestion to give to them, which is एक टेक्निक होती है मैनेजमेंट स्ट्रेटजी आप कह लें, जिसको हम CISM कहते हैं. इसका मतलब होता है क्रिटिकल इंसिडेंट स्ट्रेस मैनेजमेंट. इसका क्या मतलब होता है? इसका मतलब होता है जी, अगर एक ऑर्गेनाइजेशन है, फॉर एग्जांपल एक एनजीओ है जो फ्लड विक्टिम्स के लिए काम कर रहा है, वो एक ऑर्गेनाइजेशन है, वो एक ग्रुप है. अच्छा, उन्होंने एक ट्रॉमा देखा कि जब वो फ्लड विक्टिम्स को हेल्प करने गए थे तो उनकी अपनी बस कहीं फंस गई और उसमें पानी आ गया, मिसाल के तौर पे. देयर इज सम ट्रॉमा दैट दे ऑल एक्सपीरियंस. Critical incident stress management name, what we do is we check in immediately on the people at the same day. You don't let anyone leave without checking in, without giving them a space to normalize. ये क्यों हम करते हैं ऐसे? Because the longer you let something sit in their nervous systems, the more it develops into symptomatology. But again, I want to mention here कि जब हम कह रहे हैं ना target उसको करना है, इसका ये नहीं मतलब we are forcing people to talk about it. इसका मतलब we are providing support. फिर इसकी स्टेज होती है जिसको हम कहते हैं डीब्रीफिंग. डीब्रीफिंग हम करते हैं विद इन 72 आवर्स रिलीफ वर्कर्स के साथ. इसका क्या मतलब होता है? दैट वी आर फॉर्मिंग अ ग्रुप जिसमें जो भी लोग थे, लेट्स सपोज बस में 12 लोग थे या 20 लोग थे, they will sit together and they will talk about the incident, and we will give them space to explore narratives. And एक जो big चीज है ना, जो I think Western psychology often misses, we don't talk about, is your community is your biggest strength and support. We want to use the same people who were in that bus in order to protect other people in that bus. So we want to create a group. We can have facilitators there, one primary therapist facilitator, another secondary facilitator. And we're really encouraging people to talk about and express what's happening for them. Oftentimes, this also serves as a good tool to figure out who is at a greater level of risk or who is more disturbed, so that we are able to send them for further assessment, examination, therapy, further support. And then, the group has a follow-up, जिसमें आप हफ्ते के बाद follow-up करते हैं to make sure how workers are doing. Critical incident stress management is very important because it's like, boom, this happened and boom, we're going to intervene. We're not waiting for anything here. So some ways, so psychoeducation, the group, managing guilt, looking for signs, these are all things, preparation, predictability, these are things to keep in mind.
So from what I understand from all that you have explained, that yes, for these people who are, जिनको secondary trauma के risk पे होते हैं, the best thing to maybe encourage them to do is group therapy, and group therapy be with people who have experienced similar, been in similar circumstances, been with them on the ground doing that, because obviously they connect, they've seen the same thing or the similar things, and they can maybe even be more comfortable in sharing their experiences. But otherwise, as you mentioned previously, a judgment ka aspect hota hai ki you guys were there to help, you were not there to become victims yourself. तो वो एक उस पे चीज होती है. So obviously one of my questions on the list was कि what can these people do to preempt this, and you have already explained that. But going forward, for example, जैसे इस तरह का mass scale होता है, there are many a times जो हमारे specifically जो young youth का एक segment आप कह लो, they maybe sometimes they are the first ones doing this for the first time. ठीक है. So for them, and obviously वो एक होता है ना कि वो in the rush of the moment and वो सारा कुछ, you see this gap news, आपको एक तो overload information हो रही है, and you have maybe time, you are on break, whatever you say, I want to do this. उनके लिए again, in addition to what you have said, how can their network, their community, their family, and their how can they be a support system?
Absolutely. I think before I get into that, there's another thing I wanted to mention in terms of the precautions workers can take, which is I really want to normalize that people say that we will feel better when we are helping or supporting victims. But oftentimes, an aspect that we don't talk about enough with relief workers is that the more you help, the more helpless you also feel. Because there is greater exposure to trauma, there is greater exposure to all the things that we may not have control over. And sometimes that can become really overbearing. I think जब हम department में होते थे, हमारी orientation पे, there was a story that they told us. And the story was like, there's this boy and he's on a beach And there's different starfish, jellyfish, जो बीच पे ना ऊपर आई नहीं है wave की वजह से, और एक बच्चा पकड़ के ना एक jellyfish sea में वापस फेंक रहा होता है. And there's this old man who comes in and he says, you know, what are you doing? There's millions of sea fish throughout the seashore. You can't throw them all in. It doesn't matter. And he picks up a jellyfish and he throws it into the ocean and he says it mattered to that one. The reason I'm mentioning this story is that when we are doing work, we want to be mindful of things that are in our control and things that are not in our control. Having this feeling of having more factors in our control is also a trauma response, because at some level we forget that we are human and we start to play God. And when we start to play God, there's a lot of mental health issues that comes in with that. I want to be able to support 20 more families. I'm having flashbacks, but I really want to do 20. Of course, you're going to want to do 20 more. You're getting exposed to that. So precautionary, what can be helpful is to, you know, create a list of these are the things that are in my circle of control, and these are the things that are out of my circle of control. Oftentimes, we tell people what's in your control is the effort you are putting in. What's out of your control is the outcome of your efforts. So, you know, if there's relief workers listening to this or organizations, this is a very important point to keep in mind. I think when it comes to family and friends, like you mentioned, there's many things that they can do to, you know, support people. I think a narrative hai ke to get people to talk about things means ke they are feeling relieved. That's not always necessarily what's needed. We want to make sure we are creating a culture of autonomy. Autonomy means, you know, what is it that you need? Sometimes people don't need emotional support. They need you to change the topic. They need you to talk about something. They need you to show up in non-emotional ways. Because whenever we think of emotional support, one of the myths, I think, or common myths that comes in is that I have to emotionally support, or we have to talk about this now. Varna kaise over honge this trauma. And that's not always true. Sometimes you have to see, you know, ये person जिसको मैं support करना चाह रही हूँ, इसको क्या चाहिए? Oh, अच्छा, इसको कहीं distraction चाहिए. That's okay. At the same time, providing this non-judgmental, safe environment where they can come to you and they can talk about these things. You can psychoeducate them on trauma. You know, if you're friends and family, husband and wife and spouse living together, you can even, you know, pick up on signs. A lot of the times, Fatma, people will come in to clinics and mental health because they say मेरी अम्मी कहती है मैं बहुत सोता रहता हूँ, मुझे लगता है डिप्रेशन होगी. Okay, अच्छा नहीं, मेरी मामा ने मुझे भेजा है, वो कह रही है मुझे डिप्रेशन हो गया, मुझे तो नहीं लगता मुझे डिप्रेशन. ओके, ठीक है, क्या हो रहे हैं साइंस? वो मेरी अम्मी ने नोटिस किया था कि मैं पिछले 4 महीने से खाना नहीं ठीक खा रहा है. So the idea is that family is always picking up signs and symptoms as well, and that's a big community support. If they can pick them up and encourage their loved ones, whether in home or to get therapy, they definitely should. A side note here, very important, if you are a relief worker who is struggling with PTSD or images of things that are circulating in your head, a kind of therapy that I also practice and I know a lot of people who do is eye movement desensitization reprocessing, EMDR. EMDR is a very good form of therapy if you have images जो आपके mind से नहीं निकल रहे, or if you have trauma that's stuck in your body. So kindly look into that. The other thing is they can help with self-care, because sometimes self-care can become very difficult. Maybe self-care means getting a good breakfast so you have enough vitamins and minerals in your body. So maybe someone in the house can really help or assist with that. Giving personal space. Okay. हमारे साउथ एशियन कॉन्टेक्स्ट में इतने इन्मेश्ड रिलेशनशिप्स होते हैं कि वी थिंक कि in order to be there for someone we need to be like this with someone, and that's not always the case, or that's not always what people need. So giving them that safety to also disappear, giving them that safety, अच्छा ठीक है उन्होंने कमरे में बंद रहना, that's fine, maybe that's what they need after so even family के लिए I think expecting कि your loved ones are not going to be the same person before and after their project. They are fundamentally changing. So making space for their reactions, their diets, their relationships, their identity, understanding, even family को educate करने में, कि वो बिल्कुल एक मुख्तलिफ इंसान बन रहे होते हैं in that process. So उसके लिए अपने relationship में space रखना.
Yeah, I think these are very helpful tips, and I think slow and steady, as you mentioned, even personal space, expect करना या करना जो है ना वो in our culture gets translated into a lot of other things that maybe somebody just wants a quiet time for themselves. Even trauma, so it's obviously a bigger issue. Maybe after a heavy work day, there are times when you just don't want to talk in the house because, you've been talking a lot the entire day. Thank you so much. This was really helpful. Before I close, because I don't want to there are a lot of questions that I want to ask, but the reason I don't want to, but I don't want to drag because I want to, people to be focused on this. But I am definitely going to invite you back on the podcast, and we need to off camera discuss how we can, maybe make it a more regular thing. Mm-hmm. But for anybody for therapy work in Pakistan, thoda sa stigma bhi hai. In not just कि अच्छा therapy जा रहे हैं कुछ ज़्यादा major issue है, but एक तो ये aspect है. एक दूसरा aspect when I say stigma is the qualification and the the professional level of the therapist, because medical profession को भी बहुत गालियाँ पड़ती हैं, at times बहुत सही गालियाँ पड़ती हैं, and despite the fact it's comparatively more regulated, आपके पास वो है सारा process. In therapy, can you briefly share के what's the practicing process, क्या होते हैं? Obviously malpractice हर जगह होती है, but what are, if you are certified therapist, what's the process in Pakistan?
What's the process in Pakistan to become a therapist, Apucha?
Yeah, not just become a therapist, but इसकी कोई check and balances हैं, जैसे medical association hai. Do we have something in Pakistan? Because a lot of people don't know about this.
Yeah, no, we don't have a licensing board. We have a psychiatry ka board, lekin psychiatry means wo phir bhi doctor hai, MBBS.
Yeah.
Okay? So I do know of some people, and I'm part of this effort as well, where they are trying to create a regulatory board. But other than that, agar aap kisi therapist ke paas ja rahe hain, you please feel free to ask them questions about their qualifications. Someone who is not confident in answering questions about their qualifications is already a red flag. Someone who is not giving you enough answers or is getting offended by that question. Aapka basic right hai as a client to ask, what are your qualifications? Have you worked with issues similar to mine before? Pakistan में आप commonly देखेंगे या तो diploma psychotherapist होंगे, यानी कि कोई बाहर के affiliated program के साथ साल 2 साल 3 साल उन्होंने कोई program किया हुआ है, उसको कहते हैं diploma psychotherapist हो गए. फिर हमारे पास होते हैं जी जो masters, जैसे मैंने masters किया हुआ है कि आपने पूरा graduate school और training और internships वो सारी उसी में हैं, यानी कि psychotherapy का masters किया हुआ है. फिर लोगों ने PhDs भी की होती है. PhD अलबत्ता is a more research based thing. You can practice after it, but it's a little tricky because PhD is more research and teaching oriented. A master's program is more skills oriented. But asking people on where are your certifications, or is there some place I can read, कोई website है आपकी मैं qualifications पढ़ लूँ, and just making sure you do your own research. Unfortunately, there's a lot of malpractice in Pakistan.
If anybody wants to reach out to you, where they find you? I will link in a lot of your Instagram and your maybe anything else that you want to share with people. If you want an email ID plugged in, just let me know.
Yeah, I think people can reach out to me on my email ID, which is therapywithjahanara@gmail.com. And they can send me queries there, or if you want to professionally reach out to me, that's I think the place I answer emails. So
thank you so much for your time. This was very, very helpful, and hopefully this will build up and have, other people can also have more in-depth conversation, and people can start exploring this. So thank you so much for your time, and hopefully we'll have you back soon.
Oh yeah, most welcome, Fatma. Thank you so much for being a lovely host. I will see you again sometime.
Thank you.